When your covered California Silver plan explodes for 2026, can you save money by switching to a Bronze plan? Hello, I am Kevin Canals, an independent health insurance agent in California and also a certified covered California agent. And I've been getting calls from many clients because it looks like their silver plans are exploding in premiums for 2026. And not only are the premiums going up because the subsidies have been reduced, the Silver 70 plan isn't as good as what the Silver 73 plan was that they had in 2025. Primarily, the maximum out of pocket on that Silver 73 was $6,100 with no medical deductible. And the Silver 70 for 2026 has a maximum out of pocket of $9,800, and a medical deductible. But in terms of comparing silver to bronze, let's look at a situation, this is real life. An individual, age 45, annual income $50,000, living up in Nevada County. For 2025, their Silver 73 with no medical deductible and that low max out of pocket was $288 per month. Now this individual is going through cancer treatment, and they anticipate hitting their maximum out of pocket for the year, regardless of what health plan they have. For 2026, this individual is looking at being enrolled in a Silver 70 plan through Covered California. The monthly Blue Shield PPO premium after the advanced premium tax credit subsidy is $415 per month. That's an increase of 44% over 2025. For an annual premium amount of $4,980. The maximum out of pocket has increased by 61% to $9,800. So if we total the annual premiums plus the maximum out of pocket amount that this individual will most certainly hit because of the treatments, they're looking at $14,780 for the year. For 2026, a bronze plan for this individual, the monthly premiums after the subsidy is $235, so that's a nice savings. So the annual premiums decreased to $2,820. You'll see that the maximum out of pocket for the bronze plan is exactly the same as the Silver 70 plan for 2026, $9,800. But because the premiums are so much lower, the total premiums and maximum out of pocket amount is $12,620 for that Bronze 60 plan, and that's 14.6% lower than if they had been in the Silver 70 plan. Now this individual has another option. It is a Bronze high deductible health plan. Now the premiums for the high deductible health plans aren't that much different than the Bronze 60 plans. So, and for this individual, just $4 less expensive, so $231 per month. The maximum out of pocket, that's where the big difference is. For the high deductible health plan, the maximum out of pocket is $7,200, quite a bit less than $9,800 for the Bronze or the Silver 70. So when you total all of that up, if the individual selected the Bronze high deductible health plan, premiums plus maximum out of pocket, which they know they will most certainly hit, $9,972. So let's look at a comparison between the premiums and the maximum out of pocket between the silver and the bronze. There's a $2,160 difference, and we know that's 14.6% lower for the bronze plan. Silver versus the bronze high deductible, the annual difference is $4,808, a 32.5% reduction in the annual cost if this individual selected the bronze high deductible and they met their maximum out of pocket for the year. Now, you have to be careful with the high deductible health plans because nothing is covered until you hit the deductible of $7,200, which is also the maximum out of pocket. And when I say nothing is covered, that means that for healthcare services and prescription drug medications, you are paying the full negotiated rate between the health plan and the provider and also the prescription drugs. So if the office visit is $200, that's what you pay. There's no discount. And when all of those costs equal $7,200, you have met the deductible and the maximum out of pocket for the year. And for people that have a health savings account and want to make contributions to the health savings account, which can be tax deductible, I have a little video on those up here. It can be a good deal, but you have to be familiar with it because if you get into a high deductible health plan and you really utilize services that much and you go and you have to get a few office visits and a test and you're paying $200 or $300 for the office visit and the test is $300, it's like, whoa, that's quite a bit of money. So you need to understand what the cost of the healthcare will look like and whether it's going to work for you or not. But the Bronze 60 plan is pretty good. There are many routine healthcare services covered at a set copayment. Not all of them, but looking at those that are, comparing the Bronze 60 to the Silver 70, primary care office visits with the Bronze 60 are $60, $50 for the Silver 70. Lab tests are $50 with each plan. Tier 1 drugs, $20 for the Bronze and $19 for the Silver. So not a huge difference on those, but the premium is quite a bit lower generally for the Bronze plans than it is for the Silver. The one thing you need to be cognizant of are the outpatient services not subject to a set copayment. Under the Bronze plan, emergency room visits, x-rays, imaging, outpatient surgery, those are all going to be subject to a $5,800 medical deductible. So you need to spend $5,800 in healthcare services before the plan will start sharing in the cost of those healthcare services. So your coinsurance is 40%. That means the next dollar over $5,800, you pay 40 cents, the health plan pays 60 cents. And then when the deductible and the co-payments and the coinsurance equals $9,800, you are done for the year. With the Silver 70 plan, if the healthcare service is not subject to a set co-payment, then you go straight into 30% coinsurance, and that would happen if you had outpatient surgery. The big thing with the Silver 70 is hospitalization. If you are hospitalized, inpatient, admitted, overnight, then you must go through a $5,200 medical deductible. Then you go into 30% coinsurance. So again, the next dollar over $5,200, you pay 30 cents, health plan pays 70 cents. Then when all of your routine healthcare services, co-payments, the deductible, and the coinsurance equals $9,800, you're done for the year. The big edge that the Silver 70 plans have are in the prescription medications, because after a modest pharmacy deductible, I believe $50 for an individual, you go into co-payments or co-insurance for brand name and specialty medications, and that can save a lot of dollars. It's hard to do a comparison between the silver and bronze and what you're going to save because there's so many different drugs out there and they're on different tiered levels. But if you are taking brand name medications, specialty medications, more than likely you are going to save money with the Silver 70 plan versus the bronze. But if you don't anticipate, you know, a lot of healthcare utilization, maybe just a couple office visits, maybe taking some generic drugs, for the cost, that Bronze 60 plan, because the premium is so much lower than a Silver 70, it might be a good deal. That might be where you can save some money. Of course, if you are dealing with a chronic illness and you know that you're going to hit your maximum out of pocket regardless of the plan, you can definitely save money with the Bronze high deductible health plan because you'll hit your maximum out of pocket hopefully early in the year, and then you're just paying the lower premium amount and all of your healthcare services and prescription medications will be covered for the remainder of the year. If you have any questions or comments, you may leave those down below. I'll do my best to answer them. Otherwise, for Insure Me Kevin, I am Kevin Knaus.